Up next, we'll talk with the experts about the do's and don'ts of cosmetic surgery. Also, what your doctor's wall of certificates may be hiding.
Cosmetic surgery patient is seen as a cash cow.
Fields such as plastic surgery before they can open a practice, but that's not the case.
In every state in the United States, any licensed physician can offer you any type of surgery they want. All they need is a medical license to practice medicine in whatever state they're in. They don't need a single day of surgical training. They don't need any experience. They can do any procedure that they want. All they have to do is self-designate themselves, whatever specialty they want, and say that they're an expert, and hang up a shingle, put the advertising out, and operate on human beings.
Another way to avoid these suspect doctors is to make sure they are board certified, but sometimes even that can be deceiving.
Board certifications become a sham. Prior to 1978, the only board certification in plastic surgery was the American Board of Plastic and Reconstructive Surgery. The programs, the residency programs, were very carefully monitored. They had to meet specific requirements. After 1978, you could just buy a reputation.
Being board certified means you could be a board certified gynecologist, obstetrician. You could be a board certified dermatologist or a board certified neurologist. So if a doctor says they're board certified, it could mean in a medical field other than plastic or cosmetic surgery.
Now you have dozens and dozens of boards, and they don't mean anything because board certification is not regulated to the point where the education and the training of these people is adequate.
And there is a difference between a board-certified plastic surgeon and a certified cosmetic surgeon.
A real board-certified plastic surgeon has over 7 years of surgery training. A cosmetic surgeon has less than one, oftentimes, if even one. I mean, come on. You want to go with a creme de la creme, or you want to go with a rice cake? I mean, please.
Careful, sometimes serious procedures aren't done in the hospital.
There's very little restriction on what a physician can do in their own office or private facility. So, for example, in my office, I have a licensed surgery center, and I perform plastic surgery here. But I can actually do just about any procedure in medicine I want in my facility. And in a hospital, I'm only allowed to do what I'm trained to do, which is plastic surgery. If that physician doesn't have privileges at a hospital in their area to do the surgery you want them to do, it generally means that they're not a plastic surgeon and they're not board certified in plastic surgery.
The experts also say you shouldn't be influenced by appearances.
Quality is inversely proportional to quantity. So as a patient, if I see a very expensive building, if I see TV advertising, if my surgeon's wearing an Armani suit, I have to say to myself, this guy has a tremendous amount of overhead. And in order to pay for that overhead, he either has to charge excessively or he has to be doing a lot of procedures.
The cosmetic surgery patient is seen as a cash cow. These are people who have disposable income a lot of times, but sometimes they're just middle class and even times low income class people who really can't afford the plastic surgery.
First of all, you have to understand that mediocre and incompetent physicians don't know they're incompetent and mediocre. They don't have a clue. They think that they're world-class experts. So when you go to meet one of these, they're usually, the successful ones are very charming. They sound like they know what they're talking about. And just by listening to them, you won't have a clue whether they're incompetent or not because they don't know they're incompetent.
There are definitely doctors who clearly have an agenda, and the agenda is to cash in each time with the big bucks. You know, as many procedures as possible.
That's all for this edition of THS Investigates. I'm Samantha Harris. Thanks for watching.